Hello, everyone. First of all, I want to say thank you so much for coming out today. My name's Sarah Neely. I'm a Media Relations Officer, Public Information Officer with Sarasota County. Thank you again for taking time to be here this morning. We have some information that we would like to share with you. First of all, we have our Board of County Commission Chair, Mike Moran. He'll be followed by Sheriff Tom Knight, County Administrator Jonathan Lewis, and Chief Health Official Chuck Henry. We will take questions after everyone has completed their statements. When you get to the point where you're ready to ask a question, please let us know who the question will be directed towards so we can bring the correct person forward to the podium while all maintaining our distance. And with that, we'll get started with our Chairman, Michael Moran.
Well, hello everyone. Thank you for coming today. We wanted to update the community regarding Sarasota County's response to COVID-19. Our libraries, public beaches, and amenities like playgrounds, athletic courts, and dog parks remain closed to the public. Most of our front-facing customer service options have been transitioned to online and are also accessible by phone and email. We continue to partner with our municipalities and constitutional officers, like the sheriff, to protect the community and are working together to keep Sarasota County safe. Our Emergency Operations Center is still running 7 days a week, and county staff continues to serve the community throughout this crisis, often leaving their own families to do so. When people say public service matters, this is what it means: leaving your own family to serve others, truly God's work. We know we live in one of the most beautiful places in the country, which attracts people all year long, which is why it's so very important to listen to the executive order signed by Governor DeSantis, which suspends vacation rental properties and new reservations. Visitors are such a vital part of our economy, from the dollars they spend in our shops and restaurants to the tourist taxes that pay and help fund our projects like Beach Nourishment. We know this greatly impacts our local business owners, especially those who rely on vacation rentals as their source of income. But in order to protect ourselves and our families, we must abide by the governor's direction. The harder we push back against this virus and the more we work together as a community, the quicker it will be over and we can return to normal. That means staying home when sick, washing hands and covering your mouth when you cough, practicing safe physical distancing, and making sure that we listen to Governor DeSantis. As new information becomes available during this continuously evolving situation, we will communicate with our residents and media partners as quickly as possible. We urge you to stay home and stay safe. May God watch over the residents of Sarasota, our staff at the county, our first responders, all the doctors and nurses, and all the emergency management personnel. We appreciate and love you and your families. Our prayers are with you. Thank you for the time. Now please welcome Sheriff Tom Knight.
Well, good morning, everybody, and a beautiful day today, and thank you, Commissioner Moran and the county staff, for giving us an opportunity. I think it's important for the citizens of this county to hear from us and to hear from their sheriff and what the operations of the sheriff's office is right now. We are fully up and running. We have our operations running right now. The sheriff's office continues to engage with local and state officials as well as the Florida Sheriff's Association to ensure that we are properly prepared and have the knowledge needed to make sure we give that residents the service that they expect out of their Sarasota County Sheriff's Office law enforcement. The Sheriff's Office, following Governor DeSantis' orders, are announced to ensure residents are in compliance with those orders. And while the majority of citizens we have interacted with have been cooperative thus far, we are hoping the community as a whole will be complying with the orders that the governor has put out so that we can slow the spread of the virus as a community and as a state, and that we don't need law enforcement action and intervention to help with the compliance of those orders. Regarding the governor's most recent order, which limits people from entering the state of Florida who have traveled from Louisiana, as well as from the tri-state areas of the Northeast that you all know about, he's called upon the Department of Transportation to establish checkpoints at the Florida border. However, if needed, the Florida Department of Transportation can call upon sheriffs and the Highway Patrol to assist with that. We do not have any checkpoints here in Sarasota County. We will not be stopping vehicles from outside of those states, with the emphasis on the fact that many of these vehicles may have already been here. They may be here from New York State or seasonal residents that live here part-time, and that those vehicles are permanently kept here in Florida and tagged in New York, or some other state. So if you do see a tag from New York, you don't need to call us. There's no reason or why we can stop that vehicle, and those vehicles are being stopped at the border states that the governor has put into place. We've not been asked to assist with anything additional to time in doing our part to make sure the Sheriff's Office's employees are kept safe so that we have the opportunity to go out and provide the service that first responders are expected to provide. The governor's executive order to suspend vacation rental properties is an order that should be taken very seriously. We all know Sarasota County is a beautiful place, but this is not the time to vacation and expect to have a vacation rental opportunity to come here and vacation at this time. This applies to all beach properties along our coast as well as short-term rentals like Airbnb. The new order does not apply to hotels, motels, resorts, or long-term rentals. Violation of the order may result in a second-degree misdemeanor, but again, we do not want law enforcement and sheriff's offices becoming involved as an intervention point. We're asking for self-compliance. Another area of concern of residents as we live in this beautiful area is everybody likes to boat, and everybody knows that. We want everybody to keep their social distancing on the waterways and practice social distancing when they're out on the waterways right now and they're boating. We have our full Marine unit out running along with the local police departments and the Fish and Wildlife Commission to patrol the waterways to make sure they're safe with the heavy boat traffic we have now. As everybody probably knows, the Fish and Wildlife Commission put out an order for mooring of 50 feet apart. And yesterday, from the reports I got back from our Marine unit, thank you to this community and to the visitors who are coming into this community. We saw nothing but great compliance with it. And in some regards where we did ask people not to be in huddles of 10 or more, everybody was compliant and would disperse as they were asked to disperse. So we're asking everybody to continue with that in our waterways, in our boating, in our vessels, and to do it voluntarily, not just mooring the boats off 50 feet apart like we saw yesterday, but also let's make sure that we don't huddle up in groups of 10 or more. It's important the community understand we'll continue to educate before we enforce, but we're also placing responsibility in the hands of our residents. Simply put, please just stay at home if you can. If you're out, please make sure you comply with the executive orders the governor's put out. If you're boating, please continue to do the great things that we saw yesterday anecdotally on the water, the way you moor your boats, and most importantly is please don't cluster as groups of individuals in the boating areas. So there's plenty of healthcare workers, emergency personnel, and the first responders are going to be out here every day to keep this community safe. We don't want to put our people in any greater risk by engaging individuals. So again, we're asking for individuals to continue to do what they're doing, continue to comply with the governor's orders and the Fish and Wildlife Fish Commission's orders, have a good time, but know what you're doing, and if at all possible, this is a great time to stay at home. We don't want law enforcement involved in a health issue. Thank you.
Thank you, Sheriff. I appreciate that. Our 2,200 county employees are working for the community right now. Many of them are doing it via e-work, working from home, using our county resources to provide the services that you've come to expect from our employees. We do have employees who are essential to the operation of the county. People in our public works and utilities departments, our bus operators that are working right now. And what we need you to do, if you see them out and about, we appreciate that you want to thank them for their service. But just like we're asking them to practice social distancing and safe practices, maybe just say thank you or hi to them from across the street instead of coming up and giving them the words from up close. You'd be amazed how many people are coming to thank our employees for continuing to do their work. We just want to make sure that as we go ahead, they're safe and they're able to provide services for our community. The chair mentioned this earlier, but we've created more opportunities for people to engage county services online or through 861-5000. Almost all of our building functions are now online and can be done that way. We've limited the access to our facilities, so it's by appointment only, and if it's something that can be handled online, that's the way we're going to push people. We appreciate you to continue to check both our website, or if you need to, call 861-5000 and they'll help you. Our county employees are working to follow the directions of the CDC and the Department of Health and the practices they utilize. And I just want to again ask you to do the same thing, both for their benefit and yours. We will continue to provide essential services here at Sarasota County that our public needs and expects. I do want to thank you for your support and your understanding for our county employees as we continue through this effort. Thank you.
Good morning. As your local public health official, I appreciate the opportunity to participate in this press conference and re-emphasize important things for our community. I want to assure you that our public health staff is hard at work and continues to work both on those essential core public health functions that must go on, as well as addressing COVID-19. What's most important to me this morning is to re-emphasize our Surgeon General's direction to our vulnerable population. That population is those over 65 years of age and those with significant underlying health conditions. It's critically important at this point in this COVID-19 outbreak that those individuals isolate themselves, quarantine themselves away from others, so avoid contact, practice social distancing, and really avoid contact with anybody that's not in their home already. And even within the home where they can keep distance, it's a good idea. We also encourage them where that's not possible to avoid groups of larger than 10, although I really discourage our vulnerable population from gathering in any big groups. When you can't do that, we want to make sure that you're practicing that social distancing, 6 feet. For most people, that's 2 arm lengths, just to give you an easy judgment. We want to re-emphasize, as you've heard already from the other speakers, the importance of hand washing, frequently, vigorously, for 20 seconds with soap and water. That is our best protection. More often that we do that, the better. And especially if you feel a need to touch your nose, eyes, or mouth, wash your hands immediately before that with soap and water to make sure they're clean. If soap and water is not available, hand sanitizer is the next best option, but we want to make sure that that sanitizer has an alcohol content of at least 60%. It's also important that all individuals in the community, not just those with over 65 years of age and those with underlying health conditions, also practice social distancing. I have to say our community has been really good about this so far, and I encourage you all to continue. The more that we all stay away from each other, the quicker we'll be able to stop the spread of this virus around the community and help prevent the more serious cases from overwhelming our healthcare system. That's really critical in our strategy to move through this period. It's just as important for business owners, managers, supervisors, and those that have employees to do their best to allow employees that can telework to telework from home and to try to reduce their staffs down somewhere near that 50% or lower target, because the fewer people we have moving on the street and engaging with each other, the better our community will be. I do want to address some confusion in the community around 2 definitions that are pretty common in this discussion: isolation and quarantine. And I use them a little bit interchangeably earlier in my remarks on purpose, because essentially they both mean the same thing, that we're separating ourselves from others. The real nuanced difference is that when we talk isolation, we're applying that term to someone that has COVID-19 or that we believe has all the symptoms, so we believe they're currently ill with the disease. And so those that are ill, we tell them to isolate away from others so that they don't spread the virus to others. When we use the term quarantine, we're addressing people that are well, but that have likely been in contact with someone with the disease, which for our community means if you're out at the grocery store, if you're out at the drugstore, if you're at work, then there's a likely chance you may have been in contact with someone. And so we're moving on that assumption. And so for those, especially if they're traveling to our area, as the governor has determined, from areas that we know there's widespread transmission, we're asking them to quarantine, which means stay away from others for 14 days after that contact, because the incubation period for COVID-19 is between 2 and 14 days. That's the time it takes from when you encounter the virus till the time you become ill, somewhere between 2 and 14 days. So quarantine is that period of 14 days that assures us that if you isolate away from quarantine, away from others for that period, then if you do become ill, you're not going to infect others unknowingly. So that's the whole difference, but essentially they both mean for us to separate and stay away from each other. Thank you.
We'll go ahead and take questions now. I would just like to remind you to please state who your question is for so we can make sure people get back and forth from the podium. Also, I'll be restating the questions that you ask so that people watching from home or on our Facebook Live feed can hear them as well.
Well, did you want to rephrase the question? Or?
If you don't mind.
Sure.
She just asked when the county will put in place a safer from home order.
Thank you. First off, thank you to the folks that I'm surrounded by. I think it's obvious to most, if you're listening, they're just absolute subject matter experts and just excellent at what they do. But it's incredibly important to me, and I think I speak for all the commissioners, that there's a consensus on this, is that there is a chain of command here. And in any type of crisis situation, I don't care if it's a hurricane or a tornado or flood, disease, virus, such as what we're dealing with here, is just making sure that chain of command is followed appropriately. That comes from the feds, down through the health departments, down through the governor's office. And I think it's just imperative that people stay in those channels of command and make sure that we're all on the same message. And anything that deviates from that can create some tension with partnering communities, for example. So I think this commission, I believe I speak for all of them. I know I'm, of course, speaking for myself, that staying in that chain of command and making sure that we follow directions closely and make sure we're giving out good information is just imperative.
The question is, why have other communities placed this safer at home order and not Sarasota County?
So I'll let the other counties comment for why they've done what they have and what they haven't. Here in Sarasota County, we've looked closely at the 8 around the state county orders that we're aware of. They are more prominently safer at home. And what we believe they do is repeat the direction that's really already come from the governor and our health agencies, which is to use good practices, good hygiene, keep those groups 10 or less, and spacing. And here in Sarasota County, we believe our residents are smart, competent people, and they're making good choices every day. And we don't know that adding a safer at home, which is what you see in a lot of the places, which are not actually orders, they're recommendations, we think that that's not necessary at this time.
The questions were, when are we getting another shipment of supplies such as PPE, and are we looking at an outbreak and how we would handle that?
Thank you for that question. Supplies continue to come in almost on a daily basis. Obviously, we don't get 100% of everything we're looking for, but the state has had some success in acquiring supplies and pushing those out to the county level based on priorities. So we are getting supplies in and doing our best to prioritize those supplies to areas that serve our vulnerable population and our healthcare and first responders who are critical to this response. In terms of are we preparing for, I think the term was used, outbreak, or yes, that's what this is all about. I think we already have a huge public health concern, not only here in Sarasota, but across the state and our nation. And everyone is responding accordingly to that. We, at the government level, especially from the health side, we try to look at all the data available. We look at the modeling out there, at what's happening as examples. Just like in hurricane season, If most of you are familiar with seeing a whole list of different spaghetti models, we look at all of the modeling out there for COVID-19 and what's happening, and we try to discern from that what that may mean at our community level or our region level, and feed that data as we can to our policymakers. They're the ones that make these tough decisions. It's my role to try to make sure they have the very best data and information available from the public health sector to do that.
The question was, are we looking at building any tent hospitals outdoors?
So first I'll say that as with any emergency, we plan for the worst. We hope for somewhat better than that. So obviously our planning includes how we expand our health system should that be necessary. We work closely with all of our healthcare systems and hospitals to understand where their situations were at, and so that we're able to expand where necessary. At this point, I don't believe that's necessary. We continue to try to provide any support that Sarasota Memorial needs as they work through those issues with their employees.
Last week during the testing, this is for Chuck Henry, we didn't see a whole lot of people getting tested because they didn't meet that criteria. Are we looking at expanding the criteria for testing?
Is the county looking at expanding the testing for, I'm sorry, repeat it one more time. The testing criteria.
Thank you for that question about our drive-through testing criteria. We are following the priority criteria from the Centers for Disease Control and Prevention. There's a number of different levels of criteria. We believe there are more than enough people that meet that criteria to fill our available slots for that testing, and they really are where we want to put that resource at, because resources are limited to test. So it's important to us that they get to those that meet those top criterias. Those criterias really are those that are ill, that are over 65 years of age, those that are ill, that have underlying health conditions. That's what our drive-through is targeting. Those that are ill enough to enter our healthcare system at the hospitals are being tested at the hospitals.
The question was, are there any cases of reported COVID-19 in assisted living facilities or nursing homes?
So great question about our most vulnerable populations out in the nursing homes, assisted living facilities, or I like to term it the elder care system. And yes, we do have some cases out there in the elder care system. Both those facilities, our Agency for Healthcare Administration out of Tallahassee and our local health department are really laser focused on what we can do to help those facilities. In fact, we began several weeks ago locally reaching out to all of our elder care facilities to ask, make sure they had all the CDC guidelines, that they were implementing those guidelines, and encourage them to do so if they weren't. We continue to be in touch, and anytime we hear of an illness in an elder care facility, even before a diagnosis is made, we're sending local teams out to meet with staff at those facilities, again, to make sure that those individuals are being properly isolated, that they have the PPE they need, and that we're reviewing all of their infection control procedures to prevent spread within those facilities.
Which facilities and how many have been impacted in Sarasota County?
So we typically don't talk about the specific locations of things going on as they relate to healthcare of individuals, and if we identify facilities, then we could unintentionally identify the individuals ill, so I won't be providing the names, but at this present time, I'm aware of 2 facilities where we have active cases.
And after Kim's question, I'll take one more from the group. We have some submitted as well. What is the sheriff's office doing to protect their deputies and employees?
That's a great question about the 995 employees that work at the sheriff's office, and I think it's important too to remember we operate the jail functions too. So everything we do right now is the CDC guidelines, following those guidelines, and making sure our people are healthy and they have the equipment and the information education that they need to stay safe and stay so they can go out and give that service. We also many times have opportunities to talk to the health department. The health department's been in our jail to make sure that our jail operations are solid. We do have inmates who come into the jail who are arrested by different police departments and stuff who are put into 14 days of isolation to keep them away from the other jail population so we don't have a problem inside of our jail. We have had instances where, and we do now, where we do have deputies at home in an abundance of caution who are isolated at home right now to make sure they're not out working amongst the other deputies and the first responders out on the street to make sure they don't spread anything anticipated something if the worst case scenario happened. But everything that we put into place, the amount of employees that we have and the contacts that our employees are having, we're monitoring it all the time, and we're using our health and safety office along with the CDC guidelines and information from the health department to make sure our people are safe so that they're not out on the street infecting other people they're communicating with. But it's essential that law enforcement services continue and that we're out there every day on the water, interacting with people, and for a positive thing. You know, you heard the county administrator talk about some of the decisions this county is. We have these great open spaces, we have great parks, we have the celery fields, we have our beautiful boating, we have everything here for the citizens to utilize. Our role with the sheriff's office is to make sure that we are out there, can be seen, and that when we need to, the only thing I've heard back from our deputies in-house was that this community is a smart community, like you heard the county administrator say. And the interactions we're having in some regards where they are clustered up of 10 or more, they're very good about recognizing it and moving along. So, but everything is healthy within inside the sheriff's office. We have 6 people right now that are working remotely. People who are pregnant and some other issues that we evaluate into each on their own occurrence to make sure we're still at work. The bulk of the people that work at a sheriff's office are qualified as essential personnel. And so we got to continue to give that service just like the fire services do here. So we're in good shape, our people are safe, and we're confident that we're making all the right steps to keep everybody out in the community, keep the community safe.
Any questions from our Tampa partners before we... All right, Tim. Is the county planning to close boat ramps?
Again, as the sheriff indicated, FWC's out, the sheriff's department are out, our local law enforcement agencies are out. The county at this point has no plan to close the county-run boat ramps. People are doing what we're asking them, and they're keeping good separation. And we don't have a public health recommendation that's necessary at this time.
All right, we have some submitted questions as well. One of which was there any, Sheriff, for you, was there any trouble on the water this weekend?
There were no problems on the water this weekend. Like the county administrator said, you know, we live in this beautiful community with wonderful parks, and we consider the waterways part of our parks here with the sheriff's office. We had all of our boats out. I myself went out 2 days just to anecdotally see what was going on in our waterways. It's really nice, like the county administrator said, we have a smart community, and that they want to take advantage of these beautiful amenities that this county's created for them. And so they're out. What I saw yesterday when I was out driving from South Sarasota County up north through the Intercoastal Waterway was people mooring their boats off 50 feet or more. Nothing's perfect. We did see where people were clustered up a little bit, but I will tell you that anecdotally is that the information I'm getting back from my field personnel in any regards is when we do approach them, they do separate. And this is a great opportunity to remind them of that, is that we want them to do it on their own. We don't want to be the ones to have to go out and talk to them about it. So we feel confident of where we're at with the sheriff's office and the boating community and what's going on out there right now. And I think it's important too, when you shut down a boat ramp, there's so many boats in this community that are on davits or on docks or in the water or in the slips, so you get a little disparate treatment individuals who have those boats. So we want to make sure that everybody in Sarasota County is being treated equally and fairly. I don't make those decisions, but I get a chance to talk to the county government about that. This is all about how we treat people and how we treat our constituents and how we treat the citizens, and we want to be fair to them. And using law enforcement at a boat dock, you know, are you a commercial fisherman or not? That sometimes drives people to be maybe not answer the question quite accurately, and we don't want to create crime with this. We don't want people to lie or mislead us. So we want to treat everybody fairly and equally. We don't want commercial fishermen to feel differently than they are the general public. And so using law enforcement at a boat dock sometimes becomes disparate treatment. And we live in America. People have their constitutional rights. The sheriff's not going to violate people's Fourth Amendment rights by searching their boats and ask them to show us their papers if they're commercial fishermen or not. So right now we feel confident with the information of what we saw this weekend on the waterways out there in the boating community, is that people are self-compliant for the most part, and those who we did contact were very generous about their communication with the deputies to separate. So I'm hoping that gives you some feel about what's going on in this community.
A question for Mr. Henry was submitted. What is the status of our hospitals in regards to PPE, personal protection equipment?
So we have a process in place through the County Emergency Operations Center to touch base with all of our area healthcare facilities, not just hospitals, but also those elder care facilities daily, to understand what their status is on a number of issues, including personal protective equipment or PPE. Again, we like to know where they're at, what their burn rate is, when they project they'll be out, and then based on that, we elevate those critical needs up through the EOC to the state to ask for resupply. And as long as we have that process in place and we're honest and straightforward about it, then the state's more responsive in providing the needs that we meet. And so we'll continue that process. I believe we're in a good shape right now, but we continue to monitor that very closely.
And this is our last question, which was also submitted. Mr. Henry, in reference to the modeling that you spoke of earlier, is there anything you can say specific to Sarasota County that you're referring to with that?
So in reference to the modeling that I mentioned, I don't have anything specific to say other than we're looking at all of the available models that we see out there that will provide data at the national and state level, and looking at how we can best take that data and apply it to our county or region. Probably the region is a better measure because as you're seeing with some of the other questions, our best success is when we act collectively together as a region, and that we use data to make those decisions. Thank you.
Thank you all very much for coming out today. We really appreciate you guys coming and standing in the sun for us for a little bit. Thank you very much. And if you have any follow-up questions, you can give them to us via email. Thank you.